You must have come across the much-hyped spice, turmeric, which is often used in food and supplements. Turmeric hails from the ginger family, predominantly in Southeast Asia. The rhizome of the turmeric plant is boiled and dried to yield that bright amber powder we commonly see in grocery stores. Remember that Thai curry you had last time? Yup, turmeric is responsible for the yellow color and that fragrant, warm, and slightly bitter taste. Apart from being used as a culinary spice, turmeric has been a part of traditional medicinal practices for a long time. It contains curcumin, a naturally occurring anti-inflammatory compound that is easily absorbed in the blood, reducing the inflammatory response. Hence, it is often used for a variety of ailments, infections, and diseases. It should be noted that while turmeric is mostly safe when used in food, the supplemental form can be detrimental to health if you do not know how much to consume. The World Health Organization (WHO) recommends 0 to 3 milligrams per kilogram of body weight as an acceptable daily allowance of turmeric. So next time you see an influencer raving about their famous turmeric latte or how certain supplements changed their life, remember these undesirable effects turmeric can cultivate in your body. Biliary disorders. If you have gallstones, it is advisable to limit your turmeric ingestion. Studies have shown that turmeric increases bile production in our body, leading to increased bile duct obstruction. So it should be avoided in conditions like cholangitis, cholelithiasis, and other hepatobiliary disorders. Bleeding disorders. If you're on blood-thinning medication, it's best to steer clear of turmeric supplements. Curcumin, the active component of turmeric, has anticoagulant properties, which means it delays the clotting abilities of the platelets in your body. Turmeric can potentiate the effect of your medicines, increasing the risk of bruising and prolonged bleeding. Avoid consuming turmeric if you often experience hypotension, which is low blood pressure. Remember, if you're scheduled for an upcoming surgery, you must avoid taking turmeric at least 2 weeks prior to surgery to avoid complications like dangerous bleeding. Pregnancy. Curcumin is known to act as a uterine stimulant, mimicking the effect of the hormone estrogen. It is an emmenagogue, a substance that promotes menstrual discharge. Hence, supplemental turmeric can lead to uterine contraction and uterine bleeding, leading to early onset of labor or even miscarriage. This is why turmeric should be avoided during pregnancy and lactation. Diabetes mellitus. Turmeric can interfere with regulating normal blood glucose levels as it can cause a significant drop in the blood sugar level. If you're a diabetic, this could lead to hypoglycemia, which is low blood sugar. You may experience shakiness, dizziness, anxiety, blurred vision, impaired cognitive function, or a fainting spell, which can be life-threatening. Gastrointestinal issues. Turmeric or curcumin can lead to increased stomach acid production. Apart from causing other damaging effects on the gastrointestinal system, too much acid can lead to the formation of gastric ulcers. Turmeric can also cause stomach upset that results in abdominal pain as well as cramps. Common complaints reported after intake of large doses of turmeric are bloating, constipation, flatulence, abdominal pain, and nausea. If you suffer from GERD or gastroesophageal reflux disease, you are well aware that acid can make you so uncomfortable. Turmeric can worsen acid reflux, leading to heartburn, discomfort in swallowing, also known as dysphagia, and regurgitation, which is food coming back into your mouth from the esophagus. Liver diseases. According to a study conducted recently, turmeric was seen as implicated in causing injury to the liver's hepatocellular structure. Turmeric can be hepatotoxic when used in large amounts, especially when used in conjunction with piperine. It's a compound extracted from black pepper that is used in conjunction with turmeric to increase its absorption. This can cause severe liver injury. Conditions pertaining to hormone dependence. Curcumin has the ability to act like estrogen hormone in our body. It can compete for estrogen receptors in the body, making it unsafe to use while receiving hormone replacement therapy. Large doses of turmeric should be avoided in hormone-sensitive conditions like endometriosis, fibroids, uterine cancer, ovarian cancer, and breast cancer to avoid complications. Anemia. Turmeric can cause iron deficiency anemia as it hinders iron absorption in our body. Curcumin binds with readily available iron in the blood, making it unavailable for absorption, hence leading to anemia. If you suffer from anemia and use iron supplements, use turmeric with caution. Kidney damage. Turmeric can lead to acute kidney injury as it can cause a significant rise in the level of urinary oxalates. The oxalates bind to calcium, and as they are water insoluble, they lead to calcium oxalate stones, one of the biggest causes of kidney stones. If you're prone to developing kidney stones, avoiding using turmeric to prevent stone formation is best. Skin irritation. According to a study, turmeric can cause skin irritation when used orally and topically. The topical application of turmeric can lead to allergic responses such as contact dermatitis, urticaria, and itching. There is evidence of edema in people consuming large quantities of turmeric. Cardiac arrhythmia. Curcumin preparations can cause cardiac disorders like abnormal heart rhythm. As per the International Journal of Cardiology, it was reported that a person experienced a cardiac dysfunction after the consumption of turmeric supplements for 1 month. The symptoms went away when the use of turmeric was discontinued. Drug interactions. Turmeric or curcumin has the ability to alter the desired results of certain medications. Due to its potential to have a big effect on the efficacy of certain drugs, it can cause significant side effects. If you use any of the following medications, avoid the usage of large quantities of turmeric or consult with your healthcare provider. If you take antiplatelet drugs or blood thinners, make sure to avoid turmeric as it can increase the anti-clotting effect of the drugs, resulting in prolonged bleeding which could be life-threatening. Some examples of anticoagulants are warfarin, heparin, clopidogrel, and aspirin. Warfarin has a very narrow therapeutic index, which means that it has a very small difference between its therapeutic effectiveness and toxic adverse effects, so turmeric should be avoided when using antiplatelet drugs. Turmeric can alter the effectiveness of various drugs used for treating various gastrointestinal disorders like antacids, PPIs, and H2 blockers, increasing the production of stomach acid. So despite taking medications for acid reflux or ulcers, you might experience nausea, bloating, dyspepsia, and esophageal damage if you consume too much turmeric. Turmeric can potentiate the effect of diabetic medicines by causing a decrease in blood glucose levels, but it can lead to the risk of hypoglycemia. Monitor your values closely to regulate normal blood sugar levels. Turmeric interacts with sulfasalazine, increasing the amount of absorption of the drug. However, this can result in kidney damage. Taking turmeric while you're on chemotherapeutic agents is not recommended. This is because turmeric can alter the efficacy of the chemotherapy drugs like doxorubicin, cyclophosphamide, docetaxel, paclitaxel, etc., hence rendering the chemotherapy ineffective. Some medications that are broken down in the liver can be altered by the presence of turmeric in large amounts. This happens because curcumin is able to inhibit certain enzymes present in the liver which are responsible for the metabolism of those drugs. Tacrolimus is an immunosuppressant used to prevent tissue rejection after organ transplants. Turmeric can alter its effect as it has a narrow therapeutic index and increases its potency. This can lead to kidney damage. If you're taking analgesics like acetaminophen, ibuprofen, or aspirin, it is advisable to avoid taking turmeric supplements since it lowers the analgesic effects of these medicines. Turmeric can alter the effect of antihypertensive medication. Studies have shown that people who consume turmeric while on hypertensive prescription had increased levels of the drug in their bodies. This holds especially true for statins. With elevated drug levels in the system, individuals might experience the associated adverse effects like muscle weakness, muscle pain, etc. Despite being claimed as a magical wonder drug from the heavens above, always remember to weigh the benefits versus the risks of anything we put inside our body. Excess of anything is bad, right? Well, I hope you learned a thing or two about the negative effects of too much turmeric in your body. Too much turmeric can have some serious adverse effects on your health, so choose wisely. And whenever you're in doubt, do your research or consult with your healthcare provider.